The purpose of this video is to help understand obesity in clinical objective terms. If you look at these two cartoons, there's a tall, lean person who may have a weight of around 80 kilograms versus a shorter person who may have more fat having the same weight. Hence, weight alone is not a good marker of obesity. And what is it that we are measuring? We are measuring the excess fat that a person is carrying. The most important parameter is the body mass index combined with waist circumference, and the less commonly used ones such as skin fold thickness, percent body fat, and then a word about screening. The most important tool is the body mass index in assessing obesity or excess fat. In essence, it is the body weight in kilograms divided by meters of height squared. Kilogram, as you've seen over here, divided by meter squared. There are a number of online calculators who can do this for you. I will leave a link. You could record your weight and height in different parameters, and online tools can convert these into kilograms and meters squared so that you can get a composite figure. Previously, we had seen that weight alone is not a good marker of excess fat, and hence the tall, lean chap over here who's the same weight as this individual has a body mass index of 25, which is normal, versus this who's carrying more excess fat with a body mass index of 32, denoting that this person is obese. Anyone who is less than 18.5 BMI is underweight, and the normal is considered to be 18.5 to 24.9. There are variations within populations. These figures apply more directly to the white and European population, whereas for the South Asian population, these figures may be slightly different. So now let's look at the overweight. Those who have a BMI of between 25 and 29.9 are considered overweight, whereas clinical obesity starts at 30 or above BMI, and anything above 30 is divided into three classes: class 1, class 2, and class 3, where the level of obesity rises as we go down this route. Between 30 and 34.9 is 1, between 35 to 39.9 is class 2, and then severe obesity is greater than 40. It's important to remember that those who are muscular and have less fat may be shown to have a high BMI denoting obesity, when actually this is not the case. Equally, patients who have lost height due to osteoporosis or kyphosis, for instance, if this individual in old age becomes stooped, or his bones are, especially in the vertebrae, are now shorter, the patient may be shown to be obese, when actually this is not the case. Equally, as we age, we may have more fat deposited and less of muscle mass. The other measure that is commonly deployed in assessing excess fat or obesity is the abdominal circumference. How is this measured? This is measured by use of a tape measure, which is around the abdomen, just above the hip bone and below the navel or the umbilicus, ideally in between these two at the level of iliac crest, which is the hip bone, the highest point of the hip bones. This is most useful for patients who have a BMI of between 25 to 35, because those with a BMI greater than 35, this is abnormal. And the reason is simple. This measures the central obesity or the visceral obesity, which is associated with high levels of risk for type 2 diabetes, hypertension, and their complications. In the white population, for a male with an abdominal circumference of 40 inches or greater, there is a very high risk. This is equal to 102 centimeters. And for a white female, it is 35 inches or greater than 35 inches, measuring 88 centimeters. Now, it's important to note that for Asian men, the abdominal circumference of 35 inches is associated with a much higher risk of comorbid conditions such as type 2 diabetes, etc. And for women, South Asian women, it is greater than 31 centimeters. So there are clear racial differences in how we interpret risk with these measurements. There are two further less commonly used measures, such as the skin fold thickness. In essence, pinching off the skin at the back of your upper arm, just above your hip bone, below your belly, and assessing that by means of special calipers shown in the cartoon over here. And then when a measurement is taken, special charts are used to assess the presence of excess fat within the subcutaneous tissue that is in the skin. Percent body fat is a more accurate representation of the amount of fat that a person may carry. However, this may require specialist equipment or investigations such as DEXA or hydrostatic weighing, and these are not readily available. So which is the best measure for assessing obesity or excess fat? Actually, it is a combination of the body mass index and the abdominal circumference that is most commonly used. Skin fold thickness and percent body fat may contribute to this assessment as well. This concludes this brief overview. If you have any comments, please do share.